Caring and compassion is, on one hand, very simple, and in another way, quite complex. Simply, it's when a health professional looks in your eyes, listens, puts a hand on you, takes time. My name is Brian Hodges. I'm the lead of the AMS Phoenix Project. This project aims to nurture and sustain learning and practice of compassionate care. I walk through the hospital. I work in a very big, busy urban hospital. And recently, we've adopted the idea that if someone looks lost, if someone needs help, we would stop, look them in the eye, and say, "Can I help you?" It doesn't take very long, but it conveys an attitude. This attitude has to become pervasive throughout the system, whether you're in surgery or you're in rehab, you're in the emergency department, you're in the community, you're in your doctor's office. It's just taking the time, and I would emphasize again, a brief time, to convey that you're listening, that you're available, and that you're present, even when you're extremely busy. The evidence is still building, but what I understand from the literature I've been reading recently, and there are several reviews about healthcare outcomes and compassion, professionals who practice in a compassionate way and environments that clearly create a caring and compassionate environment lead to patients doing better, to families being more engaged, to better outcomes overall in healthcare. Simple example from my own life. The teacher, I'm a psychiatrist, the teacher who taught me the most about caring and compassion was a surgeon when I was in training. And he said, "Brian, we probably have 4 minutes with each patient. Your task in that 4 minutes is to make everyone feel understood and cared for. And that is very possible in 2 to 3 minutes. It's a stance and an orientation. We could ask ourselves what a healthcare system based on caring and compassion would look like. I think to some degree we have many of the pieces present. In no way at the Phoenix Project do we want to suggest that people are not practicing in a compassionate and caring way. Every day I see amazing examples of health professionals who are indeed models of caring and compassion. But it's hit and miss. There are wonderful moments of caring that is the best you could imagine, and there are other moments where it's missing something important. It may be because it's overly technical. It may be because the health professionals are too busy or distracted, or that technologies sometimes have been allowed to stand in for the human touch. The Phoenix Project is also very interested in the environments where care is delivered and thinking of ways to nurture health professionals to be able to sustain their own ability to be compassionate and caring, and also to encourage those who perhaps have slipped a bit, to think about those who might be developing early signs of burnout, people who have perhaps lost a little bit of their what they came to healthcare with, why they went into healthcare. I believe that almost everyone I ever see, nursing, medicine, every health professional that I ever crossed paths with, has come in initially with a desire to care, to be compassionate. But some of us lose it along the way, and the project is interested in why that happens and how we can prevent it. We need to create a space in all of our institutions that embraces, welcomes the discussion about caring and compassion. There are many other imperatives: efficiency, cost savings, evidence-based practice, safety. These are all very, very important, but we have to be sure that sitting at the table with these other concerns is a space and a place for us to ask, are we really developing caring, compassionate care in this hospital, clinic, medical school, nursing training program, continuing education program, everywhere? So the simple answer is creating a space to be sure that that is included in our consideration of what good healthcare is. The Phoenix Project is very deliberate in the way we're thinking about how to influence caring and compassion. At one level, caring and compassion is an abstract concept. It's a bit like gravity. You know when it's there, but it's a little bit hard to define what its components are. Part of the Phoenix goal is to be very deliberate about thinking about the curriculum that are taken up in medical, nursing, and other health professional schools, the lifelong learning approaches that can be used to help people sustain and further develop caring and compassion, and to work with organizations that do accreditation, licensure, create guidelines for training to be sure that caring and compassion is embedded in all of the work they do. It may be in the future that much of what we do as health professionals is replaced by machines. Therefore, the part that is most important for us to develop is the part that no machine can ever replace, which is the human presence. Caring, compassion, humanism is the central role for us as healthcare professionals of the future. And this is why I like to say, without compassion and care, there isn't any healthcare.